The circaid reduction kit leg consists of 4 components that can be used individually or in combinations: the lower leg, the knee, the upper leg, and the foot. We start with the lower leg component, followed by the knee, and then the upper leg component. The lower leg component consists of 2 pieces: a large body portion that has numbers printed along the top and bottom edge, and a smaller spine portion. Separate the 2 pieces from one another and lay them out flat so that the number markings along the bottom and top edge of the body portion face up. Disengage the bottommost band to view all of the number markings along the bottom edge. Do not flip the spine portion upside down. Using the ankle circumference measurement first, place the bottom left edge of the spine portion on top of the corresponding number marking along the bottom edge of the body portion. Repeat this step with the top left edge of the spine portion for the calf measurement. Once the top and bottom spine tabs have been secured, adjust the center spine tab to create a smooth curve. The spine shape will be different for each patient. The component may not lay flat once the spine has been set. This is to be expected when dealing with more extreme spine angles. If there is a large difference between the 2 circumferences, the spine may not reach both, the bottom and top edge of the body piece. In this case, center the spine. With the spine in place, fold over the smaller piece. Cut the excess material from the body portion, leaving approximately 5 centimeters of overlap. When dealing with more extreme spine angles, excess material is expected to be sticking out beyond the top of the spine portion. Using the top of the spine portion as a guide, cut off the excess material. If accidental removal of the spine tabs is a concern, place the white hook tabs along the edge of the spine where the patient feels the spine needs reinforcing. Or trace around the spine tabs with a permanent marker for easy reapplication. Designate the component for the right or left leg by marking it with a permanent marker in the appropriate location. Slide the undersleeve onto the leg. The undersleeve should be pulled over the knee and should cover the heel. Ensure that there are no wrinkles in the undersleeve. The undersleeve may be trimmed in length if desired. For just a lower leg component, please trim as needed. Align the component just above the ankle bone and below the knee crease. The black side of the material should face the skin. Unroll the top 2 bands and loosely secure them to the outside to anchor it in place. This enables you to easily raise or lower the component for correct positioning. Be sure not to tuck the bands under the component. The hook tab should never make contact with the skin or undersleeve. Please make sure that you are holding the upper part of the component while closing the last band. If the component is too long for the patient, it can be trimmed by 3 centimeters. Trim along the indicated cut line on the black side of the material. Trim both the body and the spine portion. Once the component is anchored in place, unroll the bottom 2 bands and secure the bottom band to the outside. While holding the second band, detach the next band. Secure the second band and continue this process with the other bands going up the leg. The component should lay flat and wrinkle-free against the leg. Adjust each band to a firm and comfortable compression level. Ensure that the bands are placed in an alternating order. Once all bands are secured, Inspect the component for any gaps or creases. Adjust the bands as necessary. The bands should be pulled to a firm but comfortable tension to provide therapeutic compression within the tolerance level of the patient. The tension measuring card can be used to identify and record the appropriate tension settings. It is not required to have all bands set to the same tension level. If more than one level of tension is appropriate for treatment, use the BTS card to identify and record the appropriate tension levels. To do so, line up the black triangle of the card with one of the BTS lines on the band. Note where the second BTS line lines up with the card's tension level. This will allow the patient to safely repeat the settings on his own. Record the tension setting for each band so the patient can easily repeat the process and ensure it is done to the same or higher tension. Once the correct tension is set, using the BTS card, you may fold the top part of the undersleeve over the top edge of the component. The bottom part of the undersleeve may also be rolled over the bottom edge if desired. To remove the component, detach all bands starting with the top band. Fold each band back onto itself to keep the hook tabs lint-free. To ensure a perfect fit for the reapplication, make sure not to detach any of the spine tabs. Lastly, slide the undersleeve off the leg.